Our next guest is here to help us by providing insight into our expensive healthcare system and share ways to lower our insurance costs. That when he's not at our mailbox wall, by the way. Welcome back, our good friend and Senior Vice President at Physicians Mutual, Bob Gunia. Welcome, Bob.
Thank you.
Great job with the mailbox wall. Great job, great job. I just got to ask you, though, I mean, our healthcare system, so expensive. Why is it so expensive? And just how expensive is it?
Great question. No one spends more in healthcare than the United States. And so just a couple months ago, the Center of Medicaid and Medicaid Services released preliminary figures for 2018, and it's going to reach $3.6 trillion, which is bigger than the economies of Canada and Spain combined.
That's staggering. To
get an idea of, what does $3.6 trillion mean? It means that for everyone living in America, that's over $11,000 that we're spending per person on healthcare. What's probably more startling is that 70% of the $3.6 trillion can be traced to lifestyle choices. And so it's what we're eating. Right. America has the largest rate of obesity, and smoking and those kind of factors is what's driving that increase. You asked, where's the money going? So 60% of the $3.6 trillion goes to the hospitals, the providers, the doctors, when you go to a clinic. The remaining part is for pharmaceuticals. And the drugs that are being prescribed is increasing at a significant rate. And the reason for that is, it's kind of a good news, bad news thing. The good news is that they're developing specialty drugs that can help people with, let's say, a group of 10,000 people that have one real specific condition that is lifesaver for them. But it can cost tens of thousands of dollars in order to treat it. So the drugs is something that we need to get a handle on. And the best advice I give for people is when you're getting a prescription, you're like, oh my gosh, I can't afford that.
Right.
Ask whether or not they can lower the price. Negotiate.
You can negotiate your prescriptions?
You should negotiate everything as you access health care. If there's no guarantee the price is going to come down,
I didn't know you could do that.
But you need to ask, because you can. There are ways to lower the price, but ask and say, I simply can't afford this. What's a better price?
So do you mean I negotiate with the pharmacist?
You negotiate it at the time that it's prescribed, so with your doctor.
Okay.
And so you could find whether or not there's some sort of special programs that maybe you can apply for in order to get the drug at a lower cost.
I think a lot of people probably didn't even know that existed.
You just need to be an advocate for yourself.
Great.
That's wonderful. That's great news. And it's sad, but also good news to know that we can change this a lot, because if it's 70% of the $3.6 trillion is because of our lifestyle,
Correct.
We can make changes. So that's good news.
Yeah. Absolutely it is, for sure. And insurance is obviously such a massive lifesaver for so many people, but it can also be so expensive. So the question is really, are we getting our money's worth here?
Correct. So how you finance healthcare is important, and that is through insurance. If you take a quick step back, and when you ask yourself, so who is financing the healthcare? Well, 170 million people get coverage through their employers. And so the employers cover about 70% of the cost of your healthcare insurance when you're in a group plan. So in order to reach that $3.6 trillion, you need someone to help subsidize it. So the employers are subsidizing the cost, as well as taxpayers. And so the Medicaid program has 70 million people that they're covering, and that's all funded through taxpayer dollars. And then you have the Medicare program, where it's covering 60 million people. Where it becomes challenging is the group of people that have individual health insurance. And when they have to shoulder all the costs themselves, that's where it can become a challenge in terms of the coverage. When you ask the question about, so where is is it worth it? I would call out that it really depends on your experience with your insurance coverage. And what I mean by that is, take an example of a young family, and this does happen tragically, where they have a newborn and needs a serious heart operation. Sure. It costs hundreds of thousands of dollars. Well, for them, it's like spare no expense. This is my child. Or a loved one that is sick. You don't say, well, how much is that going to cost when it comes to my mom and dad? And so you totally appreciate the fact that that insurance policy is making you able to access the health care you need. Where it becomes more of a frustrating part is when it comes to deductibles that can get really high. You can have a $5,000 deductible in 1 year, and maybe all you're having is a broken arm. A child has one of your kids, and it doesn't meet the deductible.
Yeah.
And that's like, okay, so why do I have insurance?
It's so frustrating.
But so how you experience the healthcare system in large part kind of drives your perspective on the value of insurance. But it is critically needed because it is very, very expensive. And as costs go up, so does the cost of insurance.
But there must be an easier way. Can't we simplify it? Like, why the deductibles? Why the copays? Why not just pay a lump sum and everybody gets to go to the doctor and not have to pay?
Yeah, well, what we're trying to do is to find the right balance between people who don't access the healthcare system on a regular basis and to those who do. So use the example of the population 18 to 35-year-olds, the young and invincibles. They're not going to the doctor a lot. They want a low premium because they're saying, wait a minute, why do I need insurance? I haven't been to the doctor forever. I'm really healthy. And so to keep that low premium, then you have these copays and deductibles that only occur when you access the system. Now, when that gets out of whack and the deductibles and copays are too high, well, then that becomes an issue as well. But all of it is a way to try to find the right balance so that the average consumer is willing to have the protection that they need so they can access the health care that they will need eventually someday.
Okay, so how about the networks, HMOs and PPOs, and how do they help us save money then?
Basically, it's negotiating prices with your providers. And so they negotiate a lower price for, let's say, an insurance group, whether it's the employer or your individual insurance policy, by putting them on your preferred provider list.
Okay.
Which for a lot of people doesn't really have an impact because if your doctor and your major hospital is on that preferred provider list, that's fine. The question is when they're not. And then but at the end of the day, it's really important to know when you're accessing care whether or not, if you're in a network, to make sure that provider or that doctor is in network or the cost could go up.
Now, what about Medicare? How does that one work?
So Medicare has the same challenges, with the escalating costs, and we spend most of our health care in our final years of life. And so they're really trying to balance that as well. And Medicare only covers, as we've discussed in the past, 80% of the health care costs for seniors. And so what they do is they end up buying a Medicare supplement policy, Physicians Mutual. We sell that policy. And what we've done is to be innovative as well to find that right balance between a deductible and a low monthly premium. And so we've come up with something that's innovative that we've got approved in all the states that basically allows you to have deductible for a shorter period of time, only in the early stages, in exchange for a life of premiums being lower than what they would be without it. And again, it's trying to be creative because we know it is a challenge for people to find a way to afford insurance.
Yeah. These are all great tips. I'm going to bring it back to something that you kind of brought up initially, and that is our lifestyle and how important our lifestyle can be with respect to our overall health and our healthcare costs. So what kind of lifestyle changes can we make in order to keep those costs down?
Well, there's a lot of research, and it's just starting to really take off in terms of food as medicine and moving from the pharmacy to the pharmacy and really looking at what you're putting in your body and the impacts that it can have. Folks way smarter than me are really looking into, why is it that peanut allergies are so prevalent today, but they weren't decades ago? Sure. Why is there such an increase in autism, but there weren't decades ago? And so we're really looking at your gut health, that some of the research are saying it all starts down in your gut and the things how that's impacting your overall healthcare needs. And so kudos to both of you, probably your epitome of health.
Well, we're trying.
Cameron and Debbie. And so what you're doing, though, the lifestyle you're living, that's the greatest impact you're having on your healthcare costs.
Yeah, just so be aware of what you're
good to
eating,
know.
get out there and get active, and all sorts of other things. Bob, thank you so much
for
all the incredible.
You're always so good. Thank you, Bob. I feel healthier already.
For more information, be sure to go to physiciansmutual.com.